Well, good afternoon. Today, federal officials provided some details about their plans to roll out the first vaccines in Canada. They made a few points very clear. The first vaccines will be approved and available in early 2021. Initial supply will be very limited, and there's still a lot of work left to do. There are many questions left unanswered. We need to know, in no uncertain terms, what vaccines Ontario will receive, how many of them we will get, and when exactly they will arrive. These are three fundamental questions that I've been asking for several weeks now. They remain unanswered. What I can tell you is that Ontario will be ready to do our part. And I should be clear about what our part is. As we know, the federal government is responsible for acquiring the vaccines. They will determine which vaccines we get, how many vaccines we get, and when they come to us. Ontario's role is to have the plans in place, to have the distribution network running smoothly, to get the vaccines where they need to go. Together, we will ensure that every person in Ontario who needs a vaccine, every person who wants a vaccine, will have access to one as we receive them. And I can't stress enough how complicated this task will be. When we look at a province the size of Ontario, and with so many fundamental questions still outstanding, the job becomes increasingly complex and a logistical nightmare. That's why we're putting our best and brightest on the task force. With the support of General Hillier, we have been working around the clock to prepare for all scenarios. And as General Hillier said, we need to have clear plans for infrastructure and supply chains in place the day the first vaccine lands on our soil. For months now, we have had hundreds of officials planning for the day we receive our first vaccines. As General Hillier said, he's amazed at just how much work has been done. And I give all the credit to the Minister of Health, Solicitor General, and their team. But we're taking nothing for granted. That's why, in addition to General Hillier, we're bringing together the best and the brightest for our COVID-19 vaccination task force, which will be announced tomorrow. This task force, our experts, will take a hard, close look at our extensive planning. They will stress test and make sure, beyond a shadow of a doubt, that Ontario will be ready. My friends, this is critical because these vaccines are how we get out and get rid of this pandemic. They're now available. We'll be moving forward. I apologize. They're how we're able to visit extended friends and family. They're how we get businesses back on their feet. These vaccines are how we get life back to normal. And so many months into this pandemic, after Ontarians have made so many sacrifices, this can't come soon enough. Thank you, and God bless the people of Ontario. Now I'll be happy to take questions.
We'll go to the phone line for questions. First question, please.
Your first question comes from Lorenda Redikoff with CBC News. Please go ahead.
Hi, Lorenda.
The other parties were criticizing you for not announcing yet who's on that task force. I guess you will be tomorrow. Why has it taken that long?
Well, let's be very clear. The Minister of Health, Solicitor General, and their teams have been working on this for months. When I first met General Hillier, he had an opportunity to sit down with those teams, and he was amazed on how much work they've been doing. They've been working on this for months right now. So have we delayed anything? Absolutely not. Are we going to be announcing the task force? Yes, we are. I'll pass it over to the Minister of Health.
Well, we will be announcing the task force tomorrow to continue the work that has already been started by the Ministry of Health and the Solicitor General's office. But it's really important to get people with a variety of knowledge and experience in this group, and that's what we have compiled. People have been very grateful to be asked and are really enthusiastic about participating in this. So we have medical experts, we have IT experts, we have people that are involved with communications, dealing with logistics in a military manner. In addition to General Hillier, there's also a bioethicist who's going to be joining the group, which is going to help to make decisions about who is going to receive the vaccination after we get through dealing with people in long-term care homes and our frontline healthcare staff. I think there's no suggestion that we do anything other than start with them first, but they'll be making recommendations to us as a government about who they think should then be next in line, because this is a program that's going to take a number of months to fully unroll. We've heard that there's not going to be very large shipments coming in. There's going to be shipments coming in periodically, and then we have to make sure that we can make sure that the appropriate people are vaccinated. So thank you.
Follow up?
To another issue, excuse me, looking at the outbreak situation with long-term care homes, there's one in Whitby, Sunnycrest Nursing Home, where they have 136 residents, 111 are currently positive for COVID-19. What's happening at that home, and what is your government going to be doing?
I'll pass that over to the minister.
It is a very concerning situation. I am very familiar with Sunnycrest Nursing Home in Whitby, and they do have a large breakout. But I understand that they have been working with the local hospital, with Lakeridge, and that Lakeridge is going in and is going to take over control on a voluntary basis. This is an agreement that has been reached with Sunnycrest to help get the situation under control, to make sure that the residents are cared for. If they need to be transported to hospital, of course, they will be taken to hospital, but they will be assisting with procedures there, infection prevention and control, and whatever else needs to be done to bring the situation under control and to help the residents get well.
Next question.
Question comes from Haley Cooper with News Talk 1010. Please go ahead.
Hi, Haley.
Thank you. Hi, Premier. We wanted to circle back and get an update on your conversation with the CEO of Pfizer on Monday. Just wondering what you two discussed. Were you given any assurances, that kind of thing?
Yeah, no, it was a great discussion with the CEO of Pfizer. We are going to get it. They couldn't give us an exact time. It is going to go through the federal government. So we're waiting for the federal government to give us an exact date. And I go back to, when are we getting it? What type of vaccine are we getting it? And how much are we getting? It's absolutely imperative we find out those three questions.
Follow up?
Thank you. And my follow-up, are you and the Health Command table in talks perhaps internally or on a national level about possibly reducing the time people need to self-isolate from 14 days to 10 days as the CDC has done?
Yeah, so we're working on that right now, but the best person to answer that is the Minister of Health. Thank you.
Well, yes, the CDC has come forward with a recommendation about reducing the number of days for quarantine. And that is something that we're studying right now with the Chief Medical Officer of Health, the Public Health Measures Table, the Command Table generally dealing with health matters. So there isn't an answer on that right yet, but it is something that we are actively looking into right now.
Next question.
Your next question comes from Laura Stone with the Globe and Mail. Please go ahead.
Hi, Laura.
Hi there, Premier. You say you've been working on this vaccination plan for months, but you're still not announcing anything today. Why are you delaying the announcement of this task force? And we know that other provinces have given some details of what they're doing, such as when you'll be receiving the first shipment, who in the province will get immunized first, and what is the goal for percentage immunization in the province. So can you please answer those questions as some of your colleagues across the country have done?
Yeah, well, we're going to be announcing the task force tomorrow, and we'll be answering a lot of those questions tomorrow as well, but I'll pass it over to the Minister of Health.
Well, yes, we are going to announce the members of the task force tomorrow. We're just dotting the I's and crossing the T's on some of the documentation for them, but that will be ready by tomorrow because I know that people in Ontario want to know who's going to be on this task force and what their role will be. In terms of some of the measures and discussions that have been led by some of the other provinces and information that they've released, we want to make sure that the task force has the option to consider the work that's already been done, make their final recommendations recommendation to us before we then go forward and make announcements to the public. So we have to do this in the appropriate order, and it starts with the announcement of the task force tomorrow.
Follow up?
So why wasn't this started earlier? The feds now say provinces should be ready by December 14th. You're delaying this task force. If you had to sign some paperwork, I mean, why wasn't this done before December?
Yeah.
That this would be happening early next year. So are you able to explain to the public why it is that Ontario can provide no details right now about what your immunization plan is?
Well, what I can guarantee the people of Ontario, we will be ready. As sure as I'm standing here, we will be ready. We have a phenomenal team. We have a phenomenal leader with General Hillier leading the charge per se. And we're ready, we're organized, and as soon as they land on our soil, they'll be shipped out right across the province. But again, I'll let the minister follow up on that.
Well, as the Premier has indicated, and as General Hillier has indicated, we will be ready. We will be ready to, as soon as those vaccines land, to be able to ship them out to the places that have already been designated. But there is a lot of work that still has to be done in that respect, because there has to be a determination made, even if they're being sent, for example, to long-term care home, to understand, first of all, how many people will actually physically be able to receive the vaccine. We need to understand how the vaccine interacts with people that have several comorbidities. We also need to know how many people will refuse the vaccine. That is also possible to happen. And there are others that want to receive the vaccine but don't want to be the first ones to receive it. So there's still a number of questions that need to be answered, but we're working through all of those issues now, and we will be ready as soon as the vaccine lands in Ontario.
Next question.
Your next question comes from Brian Passafume with the Toronto Sun. Please go ahead.
Hey, Brian.
Hey, good afternoon. I've been speaking to a lot of restaurant owners about the caps on the food delivery app fees, and generally they're pleased with it. But one group of restaurant owners I've spoken to who aren't happy are the independent franchisees of restaurant chains, particularly the smaller brands far removed from the big names. I've spoken to the owner of a Quesada Burritos and Tacos restaurant in Mississauga, who was hit with the pandemic head on shortly after opening his business late last year. And like independent eatery owners, you know, he has a lot of his own money, sweat, and effort tied into his investment. My question is, why were chain restaurants specifically excluded from the legislation? And what would you tell business owners like him?
Well, the best person to answer that is the finance minister.
Thank you very much for the question. So, you know, restaurants have within the various zones, as required by these necessary public health regulations, been treated the same. We've, of course, provided a number of supports for restaurants. One of the ones, first and foremost, that was so helpful for them was about the delivery of alcohol. But in terms of the actual supports that have been provided, and in terms of the, you know, rules of operation, they've been, you know, dealt with under a similar very same, depending on the nature of the restaurant. Of course, some restaurants are set up for takeaway exclusively. Some have larger seating capacities, and those seating capacity requirements would affect different restaurants differently. But we've made sure that the rules are the same, because the rules are based on public health requirements, and those public health requirements are what's driving this. We have to make sure that we have a healthy population. Underlying success for our businesses and success for our economy is going to be making sure that we beat COVID-19, and that's why we have to take these difficult but really necessary public health steps.
Follow up?
This is my follow-up. I just, with respect, you didn't really answer my question, is why were restaurant chains excluded? Someone could just answer my question, and then I have my follow-up.
So which chains were excluded? That's what I'm saying to you, is that chain restaurants weren't treated differently than individual restaurants. But if you could,
Okay.
if you could give an example, then I could answer the question.
My next question is federal government's vaccine rollout plan from General Jonathan Vance, the Chief of Defense Staff, talks about the first vaccines being delivered during the spring thaw, and that potentially all Canadians could be vaccinated by the end of December next year, 6 months after the Americans plan to finish their program. Premier Ford, does this concern you, and what does it mean for Ontario in terms of restrictions future lockdowns and the impact of the economy?
Well, first of all, it concerns me that, we aren't rolling it out in the same fashion as be it the UK's rolling out, the United States. There's no reason at all Canada should be last in line. And I've said that before. We need to be lockstep, shoulder to shoulder with all these other countries that are rolling it out. So we aren't controlling the distribution. I'm sorry, we're controlling the distribution. We aren't controlling the procurement side of these vaccines. And we're relying on the federal government to give us some information. And then that goes back to what I keep saying. How much are we getting? What type of vaccines are we getting and when are we getting it? That's going to play a critical role, and it is concerning. We don't want to be last in line, and we shouldn't be last in line.
Last question.
Your final question comes from Miranda Anthistle with Global News. Please go ahead.
How you
Hi
doing?
there, thanks for
How
taking
are
my
you?
questions. So my first one is the Ontarians with Disabilities Act Alliance has written an open letter to your government about transparency on how decisions will be made when it comes to prioritizing life-saving treatments and who will get them if hospitals become overwhelmed. So will this information be released, and how does the government plan on prioritizing life-saving treatments?
Pass that to the minister.
Well, this is a very important issue and one that healthcare professionals asked us to deal with very early on in the pandemic because they were concerned about Ontario becoming overwhelmed in the same way that Italy was, for example. So a draft protocol was developed that had been sent to hospitals, but this is really only meant for internal purposes. But I know that a number, and is not being acted upon. It was met with a lot of concern by a number of disabilities groups and seniors groups. And so we reached out to the table at the Health Command table, reached out to the Ontario Human Rights Commission to obtain their assistance in redrafting a protocol. And I understand there's still discussions ongoing with the Ontario Human Rights Commission in order to make sure that we reach a level place where everyone is dealt with fairly in terms of dealing with the triage protocol, whether it's for people with disabilities, for seniors, racialized communities, Indigenous communities, making sure that it's fair and level for all people. So those discussions are ongoing. I'm not sure exactly how long they will be continuing, but that will come forward at the appropriate time.
Follow up.
Okay, thank you, Minister. And my last question is, according to data from Critical Care Services Ontario, we've surpassed the threshold of 200 COVID-19 patients in ICU, and that's 5 days ahead of the modeling data that was initially released back in November. So how is the province addressing this? And what are the major concerns that hospitals will now have to limit access to non-COVID related care?
Again, I'm going to hand it over to the expert.
Well, I know this is a concern, not only for hospitals, but for people who have been waiting to have surgeries or procedures done that had to be postponed during wave one. I can tell you that we are in regular communication with the Ontario Hospital Association, and there are some hospitals that are under strain and have had to put some of their surgeries and procedures on hold for the present time. But what we're doing is, first of all, we've increased the number of beds that are available by over 3,100 since the beginning of this pandemic. We're also looking at taking a regional approach to surgeries so that if one hospital is full, their ICU is full, but another hospital has some room in their ICU area, that some of those surgeries that might have been performed at Hospital A will now be performed at Hospital B. We want to keep those surgeries and procedures ongoing in the same way we want to be able to care for all of the COVID patients that come to the hospital. But that's one of the most important reasons why we've put Peel and Toronto into lockdown, because we want to bend that curve. We want to reduce community transmission significantly, because it then moves into our hospitals, into our schools, and our long-term care homes. So while these provisions I know are very difficult for many We've been advised by Chief Medical Officer of Health and all of our public health officials that it's absolutely necessary to do this. And there also has been a study that was just released by York University that indicates that these types of measures have a significant impact in reducing the community transition, and that should help to reduce the impact on our intensive care units and our hospitals so that they can keep doing all of those scheduled surgeries and procedures as well as caring for COVID patients.
Thank you.
Thanks, everyone.